A factor that dominates our budget planning is the need to address the deficit in our employee health fund. The deficit accumulated over several years to the point where last year it was projected to reach over $50 million. As I mentioned a year ago in my budget presentation to the board, if I were to look at the budget planning simply from my perspective as a fiscal manager, I would direct all of our resources towards eliminating the deficit. However, my dual perspective as both fiscal manager and as a guardian of student well-being and achievement requires that we take a more balanced and incremental approach. Last year, we returned the system to a path of fiscal solvency, fully funding the FY19 Health Fund, and I commend the board for doing that. For the first time in several years, we fully funded our health care obligations, and we embarked on the ongoing effort to contain expenses and improve efficiencies. Earlier this year, I was pleased to report through these measures, we had already trimmed the outstanding $50 million deficit by $13 million by the close of the FY18 school year to $37 million. The proposed budget that I'm proposing to you this evening demonstrates our continued commitment to responsible management and budgeting to reduce the health fund deficit. This budget request includes an additional $10 million appropriation from the Howard County Public School System general fund balance to further reduce the deficit as a result of surplus identified in FY 2018 audit presented to the board. As a result, our outstanding deficit of $27 million is included in the proposed budget as a one-time appropriation request, moving that down from $50 to $27 million.